A&P up here.
Welcome to Freedom Watch Afghanistan. I'm Tech Sergeant Gene Taylor. The Marine Corps has established an addition to their physical fitness test. Marine Commandant General James Conway says they've added the combat fitness test because company commanders in Iraq didn't feel the PFT alone was properly preparing Marines for the rigors of war.
It's got numerous events. It's got what we call a movement to contact that involves an 880-meter run in boots in the uniform. It's got an ammunition can lift, a 30-pound ammunition can with this motion. We do a lot of this, but we don't do much of that. And yet, in a combat environment, lifting your fellow Marine over the wall, loading up the back of a 7-ton, loading others into a 7, all kinds of things require that motion. So we thought we needed to strengthen those particular muscles.
The new combat fitness test also includes a combat course, which requires Marines to imitate several combat actions such as low crawling, carrying ammunition cans, throwing grenades, and carrying casualties, with a lot of sprinting in between.
So these were the types of motions that our commanders felt would be the types of things that a Marine might normally perform in combat, and we just want them ready to do so.
More information on the new combat fitness test is available online at Marines.MIL. The 3rd Brigade Combat Team, 1st Infantry Division, is doing their part in reaching out to the Afghan people. Army Private First Class Charles Wolf shows us the 126th Forward Surgical Team as they provide health care to locals in need.
The rural Nuristan province of Afghanistan has long been without primary or acute health care. A focus on sustenance has made caring for sickness and wounds a secondary thought. The soldiers of the 6th Squadron, 4th Cavalry Regiment's medical platoon offer a chance for local nationals to receive such care free of charge. It starts with a short screening process, where the medical soldiers see which locals need simple medicines and who should be given a closer look in the platoon's offices. The service is available to all local nationals regardless of age or gender. Sergeant First Class Adrian Davenport, 6th Medical Platoon Sergeant, says the local children enjoy receiving care from the U.S. Army soldiers.
I'm very impressed. The things that they come in for to be treated, some of it is really minor to us, but it means a whole lot to them, especially the kids. The kids, they love coming here. I guess once they come here and get the treatment from here, they go back home and tell their other little friends, and the next day we got an abundant amount of kids outside.
Sergeant Davenport also said the medical staff offers essential items such as bottled water and multivitamins to local Afghans. Reporting from Jalalabad Airfield, I'm Army Private First Class Charles Wolf.
When a soldier cries out, "Medic!" you know something serious is going on. Someone's been hurt and needs immediate medical attention. Corporal Robert Durham shows us how a remote clinic at a forward operating base stays prepared for that moment.
Forward Observation Base Wilderness in Paktia Province has seen its share of violence. Sometimes the FOB receives indirect fire daily. In this spot, for instance, one man was killed instantly and 3 critically wounded. In such a small, remote outpost like this, there is no hospital for hundreds of miles, but the highest level of medical readiness must be maintained. That's where the medic steps in.
My name's Steph Sergeant Myers. I'm with Charlie Troop 161. I'm the senior trauma specialist on Cop Wilderness. This is the trauma room. We have 3 trauma bays set up for casualties. We can treat up to 3 sustained, and we're set up to treat for 72 hours.
These field medics have seen the 2nd highest number of trauma cases in the country.
So far, we've had 57 casualties here on Cop Wilderness. I've been the senior medical provider throughout all of them. The majority of the casualties we've seen are like ASG, A&P, A&A casualties. So they usually come to the front gate, and we'll go down there in the gator, pick them up from there, bring them in here, and start working on them.
You wouldn't be able to tell at first glance, but this facility is stockpiled with most basic medical supplies.
We have everything normal level 1 treatment facility has, everything from antibiotics, painkillers, just basic OTC meds, basically anything you find at any level 1 treatment facility. It's pretty simple.
Reporting from FOB Wilderness, I'm Marine Corporal Robert Durham.
And that's all the time we have for this edition of Freedom Watch Afghanistan. To see previous editions of our show, you can find us on the web at pentagonchannel.mil. From all of us stationed here at Bagram Airfield, I'm Tech Sergeant Gene Taylor. Thanks for watching, and have a great day.